One of the other most common questions we get here at the clinic is about disc herniations and disc bulges. There's a lot of misunderstandings. There's a lot of fancy vernacular regarding these issues. Hopefully explain these things a little bit better and some of the options available to you. Very common problem to have a disc bulge or herniation. We estimate about 15% of the people have one and don't even know it. So the disc can bulge or herniate before they even cause pain. And on top of that, there's many people suffering with disc pain. So it's a pretty common issue. A little anatomy lesson. This is our lower back here, and our back, between our neck and our back, we have 26 bones and vertebrae. Lower back, there's 5. We can just number them, L1, L2, 3, 4, and 5. And down here's your kind of sacrum going into your pelvis. The discs are the spacers in between the bones of vertebrae. They really do two things for us. They space these bones apart, and they're our body's natural shock absorber. So when we're bouncing around and doing all this stuff during the day, exercising, it absorbs that shock. The other important goal of them is to space these vertebrae apart. So you can see how these nerves exit in between each set of vertebrae. These nerves go down in different areas. In the neck, the majority of the nerves go down into the arms, and the lower back, the majority go down to the legs. So most people have heard of sciatica, when patients are having leg pain in the back of their leg. Typically that's looking at something in the back, pinching or irritating the nerve, shooting down into the leg. So when these discs are nice and smooth, everybody's happy, everything's working well. And we take a little zoomed in look at the top of this disc here, and explain a little bit more what a disc looks like. So I explain to my patients that discs look like jelly donuts. There's a nice fiber that holds everything together, and inside there's some soft liquid. And if we look at the disc here, this part's the fibers that hold everything together, and this part here is kind of like the jello inside that absorbs the shock. And that's a good system working out. What can happen with these discs is over time, they get worn out, those fibers start tearing on the outside, and they can bulge or herniate. And there is a difference between the two. Some people use the words interchangeably. They're not exactly the same thing. What a disc bulge means is that jelly donut's still all together. It's just pushing out a little bit. So the outside of the donut's still intact. It's just pushed out a little bit. What a herniation technically means is those fibers have torn and some of that jelly is now coming out of the disc. And one doesn't necessarily more serious than the other. Typically herniations are a little more serious than bulges, but not necessarily. And what that'll look like is this model here. We got the nice disc here, and we can see this piece coming out where it's not supposed to be. You see on the other side is normal, everybody's happy, big space in there from the vertebrae. Over here where that disc is bulging out, it could be compressing or putting pressure on that nerve. So the interesting part about the disc, it's the only part of the human body with no nerve supply and no blood supply. So what that means is you don't actually feel the disc. So if someone says you have disc pain, they typically don't have disc pain, it's the disc is rubbing a nerve or something else causing pain because you can't actually feel the disc. The other interesting part is there's no blood supply to a disc. So for example, when you cut your skin, blood flows there and it heals up. Everybody can kind of understand that. But if you cut a disc, it will not heal on its own because it doesn't have a natural blood supply. The way it does heal is by movement. The discs move and the fluids pump in and out and they're able to heal. But when the disc is herniated or injured, it doesn't tend to heal on its own. So there's several treatments available to that. Chiropractic, physical therapy, acupuncture for the minor disc can handle the pain and sometimes relieve some of the symptoms. However, when there really is a nice bulge putting pressure on the nerve, massage, acupuncture therapy, all that stuff helps the muscles relieve some of the pain. But ultimately, if that disc piece is still putting pressure on the nerve, we're going to have some symptoms. So the more moderate to severe discs need a little bit more than that. What we do here at the clinic, these two giant tables behind us are spinal decompression devices. We have 2 of them here. State-of-the-art FDA-approved technology to relieve disc bulges. And what the machine technically does is it tractions or stretches open the spine in order to suck a piece of that disc back in. So the disc is out when they come in, you traction the spine and the disc can get sucked in a little bit. We tell patients they're not going to look back to normal, they're not going to be 100% typically, but if it's pushed out 3 millimeters, if we can suck it in 1.5, 1 millimeter, just enough to pull off the nerve, there'll be no more pain. So if the traction device is able to do that, we'll feel a lot better. The big advance with these tables, years ago we'd put you in the hospital into traction. You'd sit on the traction table for a whole day pulling on the spine. We found out the spine doesn't really like being pulled for 8 hours at a time. So what the decompression does is slowly pull, holds for a period of time, releases some of that pressure, and pulls in cycles. That allows your body to break. It also helps pump the fluid in there, and it can help heal or regenerate that disc to some degree. So it's a great alternative for you. Other alternatives available are epidural injections, where they do a cortisone steroid injection into the nerve to calm it down. And of course, in real drastic cases, you do need surgery. And that's pretty rare, but it certainly happens that disc is bad enough they'll need to surgically go in there and take it out. But obviously, it's a very delicate area. We want to try to avoid surgery if we can at all costs. Hope that answered your question about discs.